All right, good afternoon. My name is Dr. Amy Thompson. I'm the Chief Medical Officer. I used to be the Chief Medical Officer. I'm the Chief Executive Officer at the Covenant Children's Hospital, and we're so glad to join you this afternoon. I just want to read a short disclaimer as we get started. Just as a reminder, the information that we provide during this event is for informational purposes only. And if you have any questions around the COVID-19 pandemic, please visit our website at providence.org for medical updates. This event does not create a doctor-patient relationship, and any questions or medical advice discussed is not considered guidance on what you should do. For any medical questions, please reach out to your primary care or healthcare professional. So thank you guys so much for joining us today. This is really fun for me. So actually, I'm going to be happy to introduce our guest today, who is an expert on all things infectious disease and COVID, Dr. Richard Lampe. And I will tell you that he is a pediatric infectious disease physician that I have had the privilege of working with for a long time. He was chairman of the pediatrics department. How many years, Dr. Lampe?
27 and a half.
27. We were both commenting. I'm a pediatric hospitalist by training, and actually my mentor was Dr. Lampe. I always say the very first real patient I got to see in medical school was with Dr. Lampe. So it was destined from the beginning that we would have a long relationship. I call him my pediatric father. So he has been a great mentor and is so knowledgeable. He works for Texas Tech University Health Sciences Center and still remains in the capacity of an infectious disease physician. In fact, he and I still practice some, and so he and I worked together this weekend on a couple of patients. And so it is my pleasure to introduce him to you all today. And I'm so excited, Dr. Lampe, just for you to provide your perspective and expertise on all things in relation to COVID. So for those of those folks who are joining, talk a little bit about what it is that you specifically do as an infectious disease specialist.
Well, thank you, Dr. Thompson. It's a real privilege to be invited to do this, so thank you. I think it would be who, what, and why. So who do infectious disease pediatricians treat? They treat all children all the way from birth through the teenage years. And then where? And they treat them in hospitals. They may treat them in hospitals in the neonatal intensive care unit, in the pediatric intensive care unit, in the pediatric floor, and occasionally in specialty units in big hospitals, in the hematology oncology ward, the burn unit, et cetera, et cetera. What do they treat? They treat infections or things that might be causing fever that can mimic infections, and they provide consultation not only to excellent hospitalists like yourself and the people at Covenant, but also the pediatric surgeons, pediatric orthopedists, pediatric urologists, pediatric neurosurgeons. So the surgical side, and we do a lot of consultation with our hematology oncology colleagues too, the individuals that treat childhood cancer.
Excellent, thank you. So I just want to start a little bit talking about COVID. And so is it true that children are the least susceptible to COVID? And if so, why is that?
It is true, and to be honest with you, I simply don't know. I think we're learning about that. Children are, of course, different than adults. They are more susceptible to certain bacterial infections when they're born, and they are certainly more susceptible to certain virus infections, respiratory virus infections like RSV. But fortunately, for COVID-19, they are not as susceptible, and that's great from my perspective.
Absolutely, and that's been our experience here at the Children's Hospital as well, and also when I've been on service. So we have seen actually very few symptomatic positive children in our specific hospital setting. I feel like we're seeing actually more asymptomatic women coming in to deliver than we have seen in positive children. So if you're a parent, what is it that you would tell parents to do if they think that their child has been exposed to COVID-19?
Well, first of all, I think I'm going to give the perspective as a parent and as a grandparent. I can't imagine both parents and grandparents not at this time worrying about their children or their grandchildren. So that's normal. But from my standpoint, if they have no symptoms, you don't worry. And then you should also be reassured by the fact that while there are some serious ones, they are really rare, serious complications. If they have a respiratory infection or respiratory symptoms, fever or cough, and you know they've been exposed, I would follow your doctor, your nurse, your pediatric nurse practitioner, your healthcare provider. And in fact, not only following those, you have to now follow the rules of the city, the rules of the state that you're in, because each of those is a little different. The variation of disease in the United States is quite remarkable.
Yes, I agree. And I think that we have, here at the Children's Hospital, we have a lot of things set up for that very thing. We've got some call-in lines. So wherever it is that you live, I would encourage you to look in your community for some resources. And so we have a number as well that folks can call in if they have specific questions, especially in relation. And then we've seen the thing that you have talked about, which is the kids that we have seen that are positive are kids that have had an exposure to someone that were positive. So are the symptoms the same for kids as the symptoms for adults, and how does that differ in what their symptoms are looking like?
Yeah, so I'll have to qualify this with saying, I don't have 1,000 patient experience with this. So the symptoms are not always the same. Just like any disease, the children's symptoms may not be the same. There seems to be a little more GI issues with children. It is a respiratory virus, like with the adults, cough and chest pain. And of course, but I think it's mainly the GI issues. And of course, everybody, if they have looked on TV, they're worried about this multi-system serious aspect of things, which fortunately is very, very, very rare.
Yes, and I agree. And I think that that's been, the question that I've been asked the most whenever I'm on service is in relation to that, multi-system inflammatory syndrome. And we actually have not had any cases, praise the Lord, in our region of this. I do know in some of the other larger settings that they are having, some folks with this, but luckily we have not seen that here. And does it act a lot, Dr. Lampe, like Kawasaki's? And
so, well, I'm going to back up here for just a second. So I did some research, and I used the American Academy of Pediatrics, which keeps track of the number of confirmed COVID cases in children in the United States by state. And it is up to date as of early June. And what I carried away from that is even in California, and certainly in Oregon, and in Washington, and in Texas, where we live, the number of cases of children is low. 5% or less of confirmed cases are children. And then the number of deaths in most of the states is 0. It seems like the New York City was the hotbed for not only the MIS and this syndrome that looks like Kawasaki. Personally, here at your hospital, my hospital, I have consulted on several children who had Kawasaki syndrome, and it has had no relationship at all to COVID.
Great. So are there kids that you're more worried about? Are there kids that have certain, predispositions or, disease types or things like this that folks should be more worried about?
Yes, and because it is a respiratory virus that predominantly affects the lungs, anybody who is immunocompromised. And so when we say immunocompromised, we're talking about those children who are on chemotherapy for leukemia or for a solid tumor. So that would be one group of children. Another one might be children with chronic lung disease, premature infants that are still on oxygen at home with some what is called bronchopulmonary dysplasia. It could be children who were born with cystic fibrosis that are on medicines for that. They would be at risk. And then probably the biggest number of children are ones who have asthma, particularly if it is really severe asthma. Any of that would be a respiratory disease, put them at some risk.
And I would say that's very similar to how we've been approaching it here in the hospital medically. And those are really the same kids that are more susceptible to things like flu and things like RSV. So when we think of those common, respiratory illnesses that we see in the winter, usually in in pediatrics, that's that same population that we worry about as well with other respiratory illnesses, not just COVID.
You're absolutely right. In fact, we always, and pediatricians and healthcare providers for children always recommend influenza vaccine for all children 6 months of age and above, but in particular for the high-risk children. And I just have my fingers crossed that the vaccine, if not available this winter, will be available shortly thereafter.
Dr. Lampe, you've made me proud because I did not expect you to get through this entire questioning without encouraging the flu vaccine. So way to be. That's fantastic. So what kind of special precautions are healthcare providers and, taking around children in COVID?
So the same kind of healthcare precautions we're taking around everybody. And this has been a learning opportunity. I've washed my hands, I believe, more in the past 3 months, and I will continue to do so. I'm not wearing the mask now, but when I'm out of the house, or certainly in all of the shopping that I'm doing, if I'm doing any shopping at all, and certainly in the hospitals, I'm wearing a mask full time. And the attempt at physically distancing from others, I've had this discussion about socially distancing and physically distancing. Physical distancing will protect us. I don't think we should socially distance, except we should still communicate with each other, but from a distance.
Yeah, no, I agree. And, as the administrator of a children's hospital, I will tell you that we've taken these type of precautions very seriously at the hospital. And so really trying to ensure that we have not only good masking policies on the floors. So, that would be like for, nurses and physicians and folks that are seeing those patients to have good masking, techniques for that. But we're also encouraging masking in public places. And so I'm with you. I'm not wearing my mask right now since we're on this phone call and I'm by myself in my office. But we are really trying to take serious that message that, about masking. And I had one of my employees yesterday that shared a story with me that I thought was great about this. Is he was in the grocery store and was, wearing his mask, and this child came up to him, and the child, I think, was talking to the parent and was like, "Oh, this man must be really worried about his health," and whatever. And so my employee looked at him and he said, "Actually, son, this mask is to help protect you." And I thought it was such a beautiful message, because it's something that we've talked so much, here, is that making sure that we're taking good precautions. I'm with you. I think my hands are raw from the amount of time that we have washed our hands. But, we would be remiss if we did not encourage, to follow the recommendations that the CDC and places like that are putting into place about good hand washing. I would argue we should be doing that stuff, at baseline and those things. But I also think that really making sure that we're taking serious, masking protocols and things like this. I've also had folks ask me, when are we going to be done with screening and, these kind of things. And I've actually likened it a bit to what happened in our world as a result of, 9/11, that the entire industry changed in terms of TSA and, things that were happening. And I don't know that I'm not trying to make a prediction, but I do think that there are some things that will have long-standing effects in regards to the precautions that we're taking around infected patients.
I agree with you. One of the things that I'd like to demonstrate for our viewers and the listeners is this is the little badge, if I can get it up here, that when I come into Covenant Children's Hospital, it has a little color circle on it. So I've got a series of color circles every day that I've come in. They check my temperature, I sign in, and then I get this, which allows me then to go through it. This is protecting children in the hospital, and the ambulatory care for children is going to offer the same protection. You're going to be checked before you come in. And I know you'll wind up asking me a question about that, but I applaud this effort, and it helps me remember to bring my parking sticker, because that helps me get into the parking lot, helps me get into the hospital, and they're right there to check my temperature to make sure that I'm not bringing anything in.
Yeah, I agree. One of the things that I've been asked by a lot of parents is it still safe to bring my kids in? And obviously, we have an answer for that in the hospital around things that are emergent. But what do you think about, what would you tell a parent who's asking you those questions about, is it still safe for me to take my child to the pediatrician just for regular, checkups, for vaccines, things like this?
Yes, and this one when this started, we anticipated the need to give those children who have recently been born and would be born during these months their routine childhood immunizations. And it is imperative that that be made available,
Yes.
because we do not want to see in 6 months or a year more pertussis or more measles and those types of things. So actually, as pediatric practices have continued, they've encouraged those routine visits. And in fact, it's important for parents and healthcare providers for children to get them in for the routine care. Appropriate safety things will be done. People are not going to come in sick. There's going to be masks. There's going to be gloves, appropriate distancing. Statistically, in the United States, the number of visits in pediatric practices for that type of service has fallen off dramatically. It's really important that we not have another epidemic of some other infectious disease like pertussis, like measles, by failure to do what we can now prevent.
Dr. Lampe, they're texting me here that I think they would like you to speak just a little louder. So I'm going to ask you, when I ask the next question, you've talked loudly to me before, so I know you can do it.
Okay, okay, I can do that. I'll do it. I'll be a little louder. Thanks.
Yeah, I agree.
Yes.
I agree, and I as well am concerned about wanting to make sure when they showed the numbers that vaccines have dropped. Those are things that we're very concerned about, and so trying to get out some public information to folks that it is safe for them to come, to the doctor, and it is. We need to make sure we're still doing all of those things, preventatively. So if you have parents out there that have school-age kids, and we're about to start, or I guess we're in summer, what advice would you give them, and what should they be aware of as we're kind of entering into summer with COVID?
Yeah, good question, because if they've been school age, they've already done a lot of homeschooling. I think explore camps and other activities. And any outdoor activities, I think would be great as well. And I hope that the sound is getting a little bit better. I'm getting some feedback from, maybe it is, I'll take one of those out. So the American Academy of Pediatrics, something called Healthychildren.org, is a resource for parents to look at things that they can do for children, not only during the school year, but also after that time. And it is all very appropriate for the age of the child, all the way from toddlers and babies, all the way up to the teenagers. I am blessed with 2 grandchildren that live here in Lubbock, and they are one of them for sure is looking forward to a camp that is going to follow the rules with the physical distancing, hand washing, appropriate masks, and separation. And I think that will be good for her development. She just turned 14.
Yeah, I also have my youngest this week is at an outside camp. And so to be fair, I feel like he was having a hard time being separated from his friends for the last few weeks of school. And I've been impressed with the camps here in this area, that they're really taking precautions. But to your point, especially those activities that are outside. And I would also, say some creative ways that we can help them see their friends. I think I was amazed. My youngest is not one who always loves school. And so I think it was interesting for me, because I felt like when, school went online, that he would actually potentially be happier, because I feel like every morning, I don't want to go to school. And so it was really interesting to watch him, have some of these effects where he really missed his friends. And it was even funny, there's a couple of teachers that sometimes he, gritches about, and he was like, I even miss, and was talking about some funny things. So I agree that, trying to make sure that we can do some things. And that kind of gets me to this idea of, I do think that there has been some, psychological effects for COVID-19, on our children. And so I would love to just talk for a minute about, what do you think are some of those psychological effects? And then what are things that parents potentially should be looking for with that? And what are the kind of conversations that we can have with our kids about this?
Yeah. Again, so being a child is stressful enough without COVID, and being a teenager is stressful enough without COVID.
Yeah.
And so what this has done is just add to that complexity.
Mm-hmm.
And I think using, again, resources, I have found, getting some little feedback there, I have found the healthychildren.org has appropriate, even though it says children, it also deals with adolescents.
Yeah.
As you know, as a pediatrician and the overall chances of depression or anxiety in American teenagers is very high, 20 or 30%. And this COVID may have aggravated that. And it's, I think it's important for parents, grandparents to be aware of that, looking and doing some of the preventive things of, I understand that this is hard, that you can't visit your teenage group, but how do you think you can communicate with them if we follow the rules? Address it, get them involved in that from the teenage years. On the younger years, say, again, like you, I'm concerned about your grandmother. She can't come over. We can't go see her. We can't visit her. How can we visit with her or him, the grandfather, and find out about that? Look for ways to communicate with friends, with technology from that standpoint. And I would probably emphasize supervised technology. But what we're doing today, we wouldn't have dreamed of doing 6 months ago like this. So
I agree. I had this.
We are going to learn about this. We are fortunate at the medical school to have child and adolescent psychiatrists, and they have been providing resources online as to what parents can do and what health providers can do as they have telemedicine visits, etc.
That's great. I was saying, I had this interesting phenomenon to walk through with this. I'm a mother. I have 2 boys. My oldest boy was a senior this year. And so I was able to kind of, walk through that situation with him. I actually went with him as a parent sponsor on a mission trip with his school before the COVID things happened. And he and I talked about how I got off of that plane and I feel like the entire world had changed literally in a week. And we, walked back in and, a lot of overwhelming things at the hospital. But what was interesting for me as I, walked through this situation was seeing this from the perspective of a CEO, but then also having to deal with what I was just referring to with a younger kid who I actually thought would be happy because he didn't have to go back to school, but had a ton of questions. But then my senior having a hard time just, having to deal with loss. And there were just a lot of things at the end of that senior year that they just didn't get to do. And so, as it turns out, we were very lucky at our school that the state of Texas, after June 1st, allowed them to have an outdoor, graduation. So we were able to do a semblance of an outdoor graduation. And, we were able to get in some cars and drive by occasionally, and the teachers in my younger students class would wave. And so I agree with what you're saying, that the number one thing that I would say is make sure you're asking your kids what it is that their fears are about COVID. And then looking together at ways you can get answers, for that. And then encouraging the staff. There has been loss. There's been loss for all of our children in this, with different things that they have not been able to do. I have one of Roman's best friends has a grandmother that is in a facility. And after the graduation, we have pictures that they went in his cap and gown and stood in the yard, and they opened up her window and they did a, mock handing of the diploma and allowed her to take pictures, through her window. So I as well echo your encouragement that we have to think outside of the box, but some type of way that we can continue to keep people engaged socially. And so they've got to stay engaged socially. We've just got to figure out how to do that with the new rules.
Yeah, I think the schools have done a great job, like yourself, two of our grandchildren graduated high school, one in Dallas and one in Charlotte, North Carolina. And we were not able to attend those, but we're really proud of them and have communicated with them. I remember your trip with your son coming back, because it was during the initial phases of this. And we were fortunate enough to take one of our grandchildren to Peru last year, do the same thing. And we're so glad we did that, because there's not going to be any trip this year. That's for sure.
That's right. That's right. I do think, Dr. Lampe, we have a question.
Grandchildren are a real privilege, and are privileged to have them.
Dr. Lampe, I do think we have a question that has come in over Facebook. And so it says, I heard that children are getting multi-system inflammatory syndrome because of COVID-19. What symptoms do I need to watch for, and are there any vaccines for this syndrome?
Yeah, good question. In the city of New York, or in the state of New York, I am not sure. There have been 11 childhood deaths. 11 is still too many. And most of those have probably been related to this syndrome, because there have been perhaps 70 or 80 of this syndrome there. Since it's caused by COVID, it will be the vaccine, when it becomes available for COVID, hopefully will prevent that. In the meantime, my advice to my daughters and daughters-in-law for smaller children or any age children, if they have fever, if they have a rash, if you're concerned, talk to your healthcare provider immediately. They will know what actions to take in what part of the country you live in. Typically, they have high fever, they are just not acting well, and they have a rash.
Yeah, and I would echo that. The high fever and the rash are really the things you need to.
Sorry, I took that out to reduce some feedback there. I hope that is it. Yeah. On a statistical basis, that worries everybody, but fortunately, it is so rare. I am just amazed that there have been no pediatric deaths in Washington State and in California and in Texas.
Yep. Praise the Lord. I'm so grateful for that.
Yes,
well, Dr. Lampe, I want to thank you so much for joining me today. We were laughing before this thing started that our pictures that they put up here, I think we look so young. And that's you and I have known each other for a very long time. And this is the first Facebook Live I've ever done. So what a privilege to have done it with you. And I'm so grateful. For those of you guys who have watched, thank you for joining us. And we hope we've answered some questions about children and COVID-19. And I would just encourage you, to continue to reach out, to your healthcare provider if you continue to have questions. The American Academy of Pediatrics, AAP.org is also a great site for you to go to get information. I do think we have about 1 minute left, and I have one more question. And it says, have you seen mental health providers implement secure messaging to communicate privately? I will actually answer that question. One of the things I also am over as CEO of the Children's Hospital is our mental health, even our adult mental health practices here at Covenant. And we have implemented this as well. So we have this both with our psychiatrists, but then also with some counselors and mental health providers, nurse practitioners, where we have implemented secure messaging. And so I would encourage you to look at your local health system. And I have seen the biggest rise, and one of the biggest things that I've seen come out of Providence, which has been so fantastic, is the quick rise of being able to use telemedicine. And so I think that this COVID situation has provided a huge, up ramp for the use of these things. So my guess is that in the area where you live, look at those health systems and see what it is that they have implemented. Well, Dr. Lampe, any last thoughts as we check off here?
No, it's a privilege to have done this with you, Dr. Thompson, and I thank Providence St. Joe's for sponsoring this.
I agree. Thank you guys so much for joining us, and we'll hope to see you guys soon. God bless.